Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hey everybody, this is Nitin Chhoda with InTouchEMR.com, and in this video training I'm going to talk to you about the before, during and after patient experience. Now, I've seen so many EMR systems. I've talked to thousands of practices in all the years that I've been consulting with private practices. I myself have been a private practice owner. I'm a licensed physical therapist, and so is my wife, by the way. And one of the biggest things, one of the biggest needs that I see in private practice is the importance of one software that manages the before, during and after patient experience. Now, here's what I mean. Imagine that the patient comes in, so you have patient intake, and now the patient comes into your clinic for the first time. They need to be scheduled before you can see them as a clinician, right? So, okay, so that's scheduling. Now, this, by the way, is what I call the before patient experience. This is the before part of it, because now the patient has come in and the patient has been scheduled. Ideally, the software that you use, and this is what we do with precision at InTouchEMR.com, is that as soon as the patient comes in, you put in a bit of the patient's information, specifically the patient's insurance information, and as long as you've got the patient's permission to be able to do this, you're actually able to get the patient's data. We're talking the patient's date of birth, the patient's address, automatically. This is huge, because what this does is this saves you a lot of time, minimizes claim denials because there's no errors with manual entry. So you get that patient's information automatically. I'm talking about their date of birth and their address. You get that automatically from the insurance company. You pull it into the system. You create what's called as a patient record or a patient chart, if you will, and then of course you schedule the patient. This is called the before patient experience, and I just showed you how it can be simplified and automated significantly. Once the patient is scheduled, the next and the most important part, which is the during patient experience, comes in, because now it's the actual clinician, it's the actual licensed clinician, whether it's a physician or a physical therapist or an occupational therapist. The licensed clinician can do the documentation. This documentation, which is usually in the form of a SOAP note, subjective, objective, assessment plan. In rehab, we have what's called as a flow sheet, which can help you keep track of what the patient's done. This documentation is what the clinician does when the clinician is working with the actual patient. So this is the during patient experience. Now, incidentally, the during experience is the most important part of the entire process, because it is that documentation that is done by the clinician which basically drives the rest of the process. It's that documentation that allows the clinic to get paid. So the time of the actual licensed provider is extremely, extremely important, because it is that time of that licensed provider that's actually responsible for the billing being generated, the claim form being generated. It is that time of the provider that makes sure the practice gets paid. So this actually is very, very important over here. Hey guys, how are you? Hey. So it's this that's extremely, this section is extremely important. Now, once the physical therapist or the clinician actually does this, they actually do the documentation. Then the next part of the process is the after patient experience, which is also extremely important. Hey, Bill. So my neighbor's kids. So it's after the documentation that the next part of the process, which is the billing, is extremely, extremely important, because it is that billing that is, what I call the after process. So there's the before process, which I've marked in red here, which is the patient intake and scheduling. There's the during process, which I've marked in blue, which is the actual documentation. And there's the after process, which is the actual billing. So some people consider this the front office stuff, which is patient intake and scheduling, the actual clinical stuff, which is the documentation or the during experience, and then there's the back office stuff, which is the after patient experience, which is generally billing and collections. Now, I've done several videos on the billing aspect of the practice workflow that I would encourage you to watch on this channel. We've talked about several things. We've talked about how the claim should be generated. We've talked about depth of diagnosis. We've talked about the architecture of a patient statement. We've talked about how to get patients to pay more. You can watch all these videos on this channel. But if you want a streamlined and efficient practice, if you want to get paid more faster, you should be using a fast, simple, and integrated system like intouchemr.com. If you want a demo of what we can do for you and how we can simplify and streamline your entire before, during, and after patient experience, then go on over to intouchemr.com and request a demo. Even if you don't work with us, I strongly recommend that you request a free copy of our executive briefing on the 5 blunders to avoid with EMR. It's a full color briefing that will actually be shipped to you, and I think it will make a big difference in the way you handle the before, during, and after experience in your practice. So again, the before experience is the patient intake and the scheduling. The during experience is the actual documentation, and the after experience, which I've circled in black here, is the actual billing process. Thank you so much for watching. I hope you can simplify your before, during, and after experience so you don't have to enter data in multiple places. You should have to enter data once, and in our case, you don't even have to enter all the data because we automatically pull that from the insurance company. Once you simplify the entire process, your life is going to be a whole lot easier. Your practice will be more streamlined, more efficient, and you'll be able to achieve this with a fast, simple, and integrated system like intouchemr.com. There's nothing like this in the market. This is the most sophisticated system you'll find, and I look forward to helping you grow your practice with intouchemr.com. Thank you so much for watching, and good luck.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.